what is pressure relief? Let's talk about it. My name is Jenna Raheb, and I'm a physical therapist who specializes in wheelchairs and adaptive equipment. Today, I want to talk to you about pressure relief. So what is it, and why do you need to do it if you're sitting in a wheelchair for several hours at a time? So when you're sitting in a wheelchair for several hours at a time, the weight of your body compresses the tissue underneath your butt and your upper legs. And so that causes limited blood flow to the area, which increases the risk of pressure sores, but also increases the risk of pain. So you want to do pressure relief to reduce your risk of pain, or to prevent pain or reduce pain, as well as to reduce your risk of pressure sores. Now, how you do pressure relief in a manual wheelchair is different than how you would do it in a power wheelchair. So I'm going to talk a little bit about both today, but I do want to emphasize that if you are a wheelchair user, definitely talk to your physical therapist about this. I'm going to give you the common strategies of how you do pressure relief in a manual and power chair, but based on your abilities, your physical therapist might want to tailor this based onto what you can do, so that you can perform pressure relief properly and safely every single time. So if you're in a manual wheelchair, what you want to do is every 5 or 6 minutes, you want to do a form of pressure relief for at least 30 seconds. So you can either push up on the armrests or the wheels to do a wheelchair push-up. So you're basically pushing yourself up and holding yourself up for 30 seconds to de-weight your bottom. Or you can do weight shifts, 30 seconds in each direction. So 30 seconds going to one side, enough to de-weight the opposite side of your bottom and your upper leg. You're going to lean forward for 30 seconds, and then to the other side also for 30 seconds. And so this is why it's so important to also talk to your physical therapist, because based on the accessories on your chair and what your strength and endurance is, they'll be able to help you figure out what is the best form of pressure relief for you that's safe. Now, if you are using a power wheelchair, we're going to utilize the tilt feature of the chair. Tilt, not recline. You're going to use tilt. So you're going to tilt your wheelchair back. Now remember, to the tilt feature, so I do have a video that talks about tilt versus recline. So for tilt, both the backrest and the seat are moving backwards. And actually, I'm gonna move a little bit so that you have a better view of what this looks like in the video. I'm gonna move a little further away from you. So I'm gonna tilt, and when you tilt, you wanna tilt so that the seat is at a 45-degree angle from the ground. So that's pretty far. You want to hold this position for 5 minutes and then come back up. And you want to do that once every 20 minutes. So I'm not holding it for the whole 5 minutes right now, but you want to go back to 45 degrees, hold it for 5 minutes, and then come back up and do that every 20 minutes. Now, I know that can be a lot for some. So one of the examples is I work with a lot of teenagers, and I know in the school environment I get a lot of pushback from my patients who are teenagers, because they're in a classroom and they don't want to be a distraction, or for a variety of reasons they don't want to do pressure relief. So what I do is I work closely with those patients to figure out what are some times that we can get some pressure relief, right? I ask them to at least give me something during the day. And so we'll start with the goal of doing pressure relief once during the school day, much more frequently when they're home, but at least once during the school day, even if it means they have to go to the nurse to do it, or if it's during lunch. And then once they're able to get one form of pressure relief in per day, then I'll see if I can increase it a little bit to at least get something, because something is better than nothing. But I definitely educate them on the fact that best practice is to do pressure relief as much as I explained, but also, regardless, you should be checking your skin, but especially so if you are not doing pressure relief at the recommended frequency, you really need to be keeping a close watch on your skin. So the deal is, if they are going to do that more modified version, they really have to be really good about checking their skin. And if they ever get any increased redness or any redness at all that isn't going away within 15 to 20 minutes or isn't turning white when you push on it, then they have to do your traditional recommendation of pressure relief. So again, this is another reason why it's so important to talk to your physical therapist, because even if what is recommended and is evidence-based isn't what works for your lifestyle, they can help you figure out what works best for you. There are lots of exceptions. That is just one that I'm giving you, but definitely talk to your physical therapist about what is best for you. So I hope that this was helpful. If it was, please make sure you like and subscribe to this channel. And if you have any questions about manual or power wheelchairs or anything about pressure relief, make sure that you add it in the comments so I can add a video. Thank you.